My name is Mark. I'm a GP in the South Inner City. Myself and two colleagues, we set up a practice called Eldon Family Practice, which is on the South Circular Road. I also work in the North Inner City, looking after homeless patients in a clinic with Dr. Austin O'Carroll. So that revolves around addiction-related problems and also primary care for the homeless populations. Well, as a GP, I'm involved in the kind of delivery of comprehensive, continuous care relating to psychological, social, biomedical healthcare problems. So I think I, as a GP, have a very, important kind of perspective in that I see how much harm alcohol causes in our communities, the stigma that relates to alcohol misuse, the fact that we can mitigate our alcohol use and change that course. And a big part of the GP's role, apart from identifying alcohol misuse, is also steering patients away from harmful drinking. As a trusted healthcare professional, we have longitudinal relationships with our patients. So we're there to ask patients about their alcohol consumption, to inquire about whether or not we believe that there is misuse or addiction at play. And then we are also there to support patients when they are ready to mitigate excessive alcohol consumption. So we want GPs to be well resourced, and we want patients to have high quality relationships with the same GP. And we also then need, an integrated, rapid referral program and link with community psychosocial and addiction supports. And that's really crucial, because that particular professional, that relationship between a GP and that community link worker or professional is really important. And I think that knowing that community resource is there will enhance the confidence of a GP, a patient, to have a successful detox. I think the missing piece we need a carefully mapped community psychosocial and addiction kind of resource program. How are patients going to be supported over those 2 weeks? How are their kind of holistic needs, how are their social needs going to be cared for on top of a GP? It can't all be done in general practice. And I think what we really need in Ireland, in our villages and towns and in our cities, is a carefully mapped community resource. What is in place to help patients support them through the 2 weeks, and how is that going to, springboard the patient onwards to maintain sobriety in the coming months afterwards.